Hello, I'm Dr. Stephen Fuller, President of House Calls, a company that brings physicians to retirement communities. This video is a brief discussion of the vital importance of intervening early when a resident's health begins to fail. Early intervention will stabilize a retirement community's census, and it does this by preventing unnecessary trips to the emergency room or even hospitalizations. Here's a classic example from our experience where we recently prevented the attrition of 2 residents in an independent living community in Boise. One frail resident, like so many others, had been avoiding seeing her doctor because of the difficulty of scheduling appointments, and also of coordinating bus transportation as well as the physical stress of the trip. She had been losing her appetite and now began falling frequently. She had recently spent the entire night on the floor after falling while trying to get into bed and then not being able to get up again. She was discovered by the housekeepers the following morning, a little bruised and sore from lying on the floor all night, but apparently stable. A trip to the emergency room was obviously imminent for her, and so a caring and concerned employee of the community contacted House Calls, and we offered our services to her. Another resident, who had poorly controlled medical conditions, several of them, was getting increasingly confused, could no longer perform his activities of daily living or reliably take his medicines. A visiting nurse from the Department of Health and Welfare told him he needed to move out of his current apartment and into an assisted living community because he simply could no longer manage on his own. He and his family were about to make this move when they contacted House Calls. For both of these residents, we immediately intervened. The House Calls physician saw them in their rooms and paid a medical visit to them. He began attending to their medical conditions as well as immediately signed home health orders and physical therapy orders. Personal care services were enlisted, family members were contacted, and we all worked together as a team to bring support to these residents. As a result, the declining health of both residents was stopped and began slowly improving. And the good news is that both were able to remain in their apartments in the independent living community with the added support. These are examples which are common, and they highlight the benefits of early intervention. So what are the benefits? Well, the residents were happy with their improved health and also relieved that they didn't have to move out of their apartments and somewhere else. The baby boomer children of the residents were happy with the improved health of their parents and also because they no longer felt helpless and were not being called any longer all the time with concerns about their parents' failing health. And the independent living community was happy because of a more stable census. It is saving $3,000 a month, every month, in rental fees by keeping both rooms occupied rather than having them empty. In this model of teamwork and partnership, and when physicians are on site to lead the team, everybody wins. I know that many retirement communities have similar experiences as we have had, so I hope they can see the wisdom and necessity of proactive intervention. Thanks so much for listening, and please go to the House Calls website and leave any comments in our blog if you would like to continue this discussion.